Cardiovascular disease in women. The purpose of today's speech is to inform our audience about the symptoms, diagnosis, treatment, and prevention of cardiovascular disease in women. What is the number one killer of women in America? Breast cancer? No. Car accidents? No. Suicide? Still no. According to the Center for Disease Control, over a 12-month period, 494,000 women died from cardiovascular disease, making it the number one killer of women in the United States. Over a 17-year period of working in the medical field, I have seen firsthand knowledge in the effects of cardiovascular disease. In my speech today, I will preview the symptoms, diagnosis, and treatment of heart disease in women. Heart disease refers to the diseases that impact the normal operations of the heart and the blood vessels of the circulatory system. Some of the physical symptoms include chest pain, which is a classic symptom and is usually a pressure or squeezing of the chest. Other symptoms could include shortness of breath. Another classic symptom is stomach pain, which women usually believe to be heartburn. Women can also have a rapid heartbeat when they are having effects of cardiovascular disease. According to the Center for Disease Control, symptoms differ in women than men. We do know, for one thing, that women have smaller hearts than men do. Doctors and patients often attribute chest pain in women to non-cardiac causes, leading to a misinterpretation of their condition. Men usually experience a crushing chest pain during a heart attack. Women may have a greater tendency to have pain just underneath the breastbone or complain of abdominal pain, indigestion, difficulty breathing, nausea, and unexplained fatigue. Women are therefore easily misdiagnosed of indigestion, gallbladder disease, or having an anxiety attack. The likelihood of misdiagnosing a heart attack in women is increasing by the fact that women tend to have heart attacks later in life than men do. Some behavioral symptoms that women could experience could be the effects of juggling a career and family life, which can be very stressful for women. Also, some behavioral effects can be obesity and the lack of exercise in their daily routine and lives. There are several ways that you can diagnose cardiovascular disease in women. First of all, you can have yearly blood tests run. You can go to your doctor's office and you can have cholesterol checked. More than likely, this is done fasting and is done once a year. You can also have your blood sugar tested every 6 months. You can do this at home by a home monitor, or you can also have it done in your doctor's office. Once again, this test needs to be done fasting, where you have nothing to eat or drink, usually after midnight except for water, to get the most accurate results. The goal in treating cardiovascular disease is to open the narrowed arteries that are clogged. Some traditional treatments include a visit to your medical provider, where they can prescribe medications such as diuretics, which are water pills. They can also prescribe medications to control your blood pressure and heart rate. You can also incorporate a baby aspirin into your daily medication routine. You can buy baby aspirin over the counter at the dollar store for $1 a bottle, or you can buy the expensive brand of baby aspirin called the St. Joseph's brand. You just need a baby aspirin, 81 milligram once a day, along with your routine medication. You also need to educate yourself on your diagnosis and your disease. The more you educate yourself, the better you are at to help prevent the disease from getting worse, and some ways that you can learn to treat the disease at home. You also need to ask your provider questions. After you get the diagnosis of heart disease, once you go home, you need to research it online and then just jot down the answers and questions that you have for the doctor. Once you go to the doctor, things are running through your head and you get so confused that you can't remember what to ask the doctor. But if you jot these down just on a quick notepad, you won't forget what you need to ask the doctor when you see him, or if you have white coat syndrome like I do, you're easy to forget things when you get in the doctor's office. Once you get in the car, you're like, I should have said this, I should have said that. But if you have everything written down, it is easy not to forget some of the things that you need to ask your provider. Also, you need to make some lifestyle changes. Increase exercise, change your diet, which could be portion control, increasing exercise in your diet. Also, incorporate a low fat and a low sodium diet. If you're a smoker, quit smoking. You need to decrease and limit your alcohol intake. Another alternative form of treatment for heart disease, and which is still in research right now, and we don't know that much about it, is aortic valve replacement. If you need to look that up a little bit more, you can go to google.com. Cardiovascular disease in women can be fatal if not treated properly. Women tend to ignore the onset of cardiovascular disease because they have so much going on in their life, taking care of their home, working, school. Early and yearly medical provider visits are key factors in the prevention of heart disease. Women with a family history of heart disease should monitor their diet and incorporate an exercise regimen in their daily habits to reduce the risk of heart disease.